Hello students, today we will look into fluorosis, the incidence, signs and symptoms and treatment. Fluorosis has become a major public health problem in our country, and that is why we need to study a little bit about fluorosis. Fluoride is abundantly present in nature. It is present in the earth's crust and in the bound form cryolite, fluorspar, fluoroapatite, topaz and micas. It is present. Fluoride content of surface water is below 1 parts per million, which is often abbreviated as ppm, except in certain zones which contain 25 ppm or more. Apart from the naturally occurring minerals containing fluoride, several other factors such as use of fluoride containing fertilizers, pesticides, gases and particulate emission from industries also add to the fluoride content of soils and water. Let us look into the sources and intake of fluoride. Fluorine content is influenced to a great extent by soil condition, airborne fluoride emitted by industries and indiscriminate use of fluoride-rich pesticides and fertilizers. Drinking water is an important source of fluorine. It contains 1 to 25 or more ppm. TSC family contains the highest concentration of fluoride, about 50 to 400 ppm. To give you an example of TSC family, you all must be familiar with tea. It belongs to the TSC family. Let us look at the foods which contain fluoride. Seafoods contain a very high content, 5 to 35 ppm. Betel nuts contain 4 to 12 ppm and tobacco 10 to 40 ppm. As against this, meat, eggs, fruits, they contain negligible amount of fluorine. Fluoride is easily absorbed by passive diffusion through stomach, small intestine, oral tissue, lungs as well as skin. In humans, peak absorption through the gastrointestinal tract occurs within 1 hour. At any given level, about 86 to 97% of soluble fluoride can be absorbed, absorption from drinking water being almost complete. Intestinal absorption of this element is influenced by the presence of other substances in the diet. Fluoride absorption is reported to be reduced by high levels of calcium, magnesium and aluminum, and it is increased by phosphate, sulfate, iron, molybdenum and even the presence of high fat in the diet. Fluoride is excreted through urine, feces, sweat, saliva and urine being the main route of excretion for fluoride. Higher the fluoride content of drinking water, higher is the level of urinary fluoride in the population. However, urinary fluoride does not always reflect the fluoride status of individuals living in high fluoride areas. Let us look into the essentiality versus the toxicity of fluoride. Fluorine is often called a two-edged sword. Prolonged ingestion of fluoride through drinking water in excess of the daily requirement is associated with dental and skeletal fluorosis. Similarly, inadequate intake of fluoride in drinking water is associated with dental caries. Unlike calcium, magnesium, human body does not need fluorine for any physiological processes. Large doses of fluoride are known to lead to two types of toxic effects. One, the acute toxicity, which is a result of single massive dose of fluoride. Second, the chronic toxicity. It is due to the cumulative effect of consuming relatively high levels of fluoride continuously over several years. One of the manifestations of this type of toxicity is a disease which is called fluorosis. Fluorosis again is of two types, industrial and endemic fluorosis. Industrial fluorosis is seen in factory workers chronically exposed to fluorine gas emanating from industries based on fluorine containing ores, for example, the cryolite industry. Endemic fluorosis, it is a result of consumption of water and foods containing high concentration of naturally occurring fluoride over prolonged periods. In both these types of fluorosis, dental and skeletal tissues are primary targets and show the most significant changes. Endemic fluorosis. Endemic fluorosis is a serious public health problem in several parts of the world where drinking water contains more than 1 ppm of naturally occurring fluoride. Prominent among these are India, China, Japan, Sri Lanka, USA, Germany, Canada and Saudi Arabia. The most prominent features of endemic fluorosis are dental and skeletal abnormalities, widely known as dental fluorosis and skeletal fluorosis respectively. World map which shows high levels of fluorine. You can see Mexico, Argentina on one end, the other end is Australia and New Zealand, and in between is a large belt made up of Middle East, India, Sri Lanka, Bangladesh, China and Japan. If we look at the map of India again, Rajasthan, Gujarat and Andhra Pradesh have the maximum fluoride content in the soil. Let us look at dental fluorosis. The characteristic feature of dental fluorosis is dental mottling. In this condition, the structure of the enamel is affected during formative stages, resulting in hypoplasia, which is known as mottled enamel. This mottling is characterized by minute abnormal white flecks, yellow or brown spots or striations scattered irregularly over the tooth surface. Dental mottling is confined more frequently to the permanent teeth. Premolars and secondary molars are the most affected. Dental fluorosis occurs in children who are exposed to high fluoride intake before the completion of dental mineralization. Hence, children from infancy to 16 years are susceptible to mottled enamel. Both boys and girls are equally affected. Dental mottling is an irreversible change and hence it is a permanent cosmetic problem to the victims. Dean's index criteria describes the various stages of dental fluorosis. They are given scores from 0 to 5. 0 is normal while 5 is severe. If we look at some of these, score 0, when we talk about the normal, the definition says it is a smooth, bright, pale, creamy white, translucent surface, no white discoloration of teeth. As against this is very mild criteria, score is 2, where small, opaque, white areas covering less than 25% of the tooth surface. Moderate has a score of 4, where all tooth surfaces are affected, a marked deterioration of occlusal surfaces and brown stains may be present. Score 5 is a severe category. All tooth surfaces are affected, discrete or confluent holes, brown stains are present. Let us look into skeletal fluorosis. Skeletal fluorosis is encountered in an endemic form in several areas of the world. This disease exhibits very slow progression. Hence, it is unlikely like dental fluorosis, it can be recognized easily. Skeletal fluorosis is not clinically obvious in the initial stages. The clinical features are muscular skeletal dysfunction, arthralgia, which literally means joint pain, fixed flexion deformities, restricted movements of joints, and stiffness of the spine and sometimes paraplegia. It can be studied under different stages. Stage 1. This is a relatively asymptomatic stage. It is usually encountered in young adults whose only complaints are vague pain in the small joints of hands and feet, knee and spinal joints. Quite often, such cases may be wrongly diagnosed as rheumatoid arthritis or osteoarthritis. At this stage, only the radiological examination helps in the diagnosis of fluorosis. In stage 2, there is obvious stiffness of the spine with limitation in movement that is observed. Stage 3, there is development of kyphosis. Kyphosis is the unnatural curving of the upper back. It looks like a hunch. There is stiffness and limitation of the movement of various joints, especially inability to bend downwards, backwards, and the neck rigidity. There is loss of movement due to calcification of intervertebral ligaments, which renders the vertebral column rigid. This abnormal calcification also results in narrowing of intervertebral foramina and the spinal canal and the compression of vertebral discs. The neurological lesions often encountered in advanced cases of skeletal fluorosis are believed to be due to the above changes. However, recent findings have shown that it could also be due to a direct toxic effect of fluoride on the neurons of smaller nerve fibers. This is how it looks like: a regular joint and a joint which is calcified with the presence of fluoride. The normal leg doesn't appear like that because of the abnormal fluorosis that is occurring in the leg. Genovalgum or genovalgum, it is a variant of severe form of skeletal fluorosis termed as genovalgum or the knock-knee syndrome. It is commonly seen in certain endemic areas of China, South Africa, India, and Tanzania. Young adolescent people are the chief victims of this syndrome, with higher preponderance in boys. Besides dental and skeletal fluorosis, extensive osteoporosis of the limb bones is seen. Secondary hyperparathyroidism and osteomalacia are associated in this syndrome. Let us look into the etiology, incidence, prevention, and control. Water fluoride. Several epidemiological studies the world over reveal lack of direct correlation between fluoride content of water and the incidence as well as the severity of both dental and skeletal fluorosis. In American conditions, prolonged ingestion of water containing up to 8 ppm fluoride over 15 years or more did not cause skeletal fluorosis. On the other hand, in India and other countries, such high levels of fluoride in water leads to crippling skeletal fluorosis. Thus, the course of the disease fluorosis does not depend solely upon the concentration of fluoride in the drinking water. Let us look at the food fluoride. There is a daily intake of fluoride. High incidence of dental fluorosis, 98%, and skeletal fluorosis is observed in a province of China, although the fluoride concentration in water in the same region is only about 0.18 ppm. Total fluoride intake of the above population was found to be 8.6 milligrams, and food alone contributed 7.6 milligrams, which is about 87%. Dental fluorosis is also reported to be encountered in Vietnam and Thailand, where water is low in fluoride, but the foods contain high fluoride content. There is a possibility of major dietary staples consumed by population living in endemic fluorotic areas influencing the severity of fluorosis. Population consuming sorghum as staple were more likely to develop severe manifestations of fluorosis than those whose staple food was rice. Role of other trace elements: excess intake of silicon, molybdenum potentiate fluoride toxicity. Contrarily, copper deficiency aggravates fluoride toxicity. Anemia and osteomalatic lesions are often encountered with fluorosis. Dietary practices. They also influence the fluoride intake. Parboiling of paddy is one of the practices where the processing enhances the fluoride content of rice significantly, the increase being directly proportional to the fluoride content of the water used. Implications of this in rural fluoride endemic areas where parboiling is practiced at household levels is obvious. Incidence. Fluorosis is a public health problem in 24 countries including India, which lies in the geographical fluoride belt that extends from Turkey to China and Japan through Iraq, Iran, and Afghanistan. Of the 85 million tons of fluoride deposits on the Earth's crust, 12 million are found in India. Hence, it is natural that fluoride contamination is widespread, intensive, and alarming in India. Endemic fluorosis is prevalent and reported in India since 1937. It has been estimated that the total population consuming drinking water containing elevated levels of fluoride is over 66 million. India is rich with fluoride, which forms the major reason for fluoride contamination in groundwater and the granites in the districts of Nalgonda of Telangana. It contains much higher fluoride than the world average fluoride concentration of 810 milligrams per kg. The available data suggests that 15 states in India are endemic for fluorosis, where the fluoride level in drinking water is more than 1.5 milligrams per liter. And about 62 million people in India suffer from dental, skeletal and non-skeletal fluorosis. Of these, 6 million are children below 14 years. This is because a large number of Indians rely on groundwater for drinking purposes, and water at many places are rich in fluoride. WHO has set the upper limit of fluoride concentration in drinking water at 1.5 milligrams per liter, and the Bureau of Indian Standards (BIS) has therefore laid down Indian standards as 1 milligram per liter as maximum permissible limit of fluoride, with further remarks written as lesser the better. Prevention and control. Since fluorosis is irreversible, its prevention is most appropriate using various intervention measures. Most important is using alternative water sources. Simple interventions including provision of surface water, rainwater and consumption of low fluoride groundwater. Then removing excess fluoride from drinking water. Defluoridation of water through flocculation and adsorption is important. Again, important is the health education and better nutrition, and these are some of what we call as cost-effective intervention measures. This is the famous Nalgonda technique, where lime and alum is added. There is flocculation, sedimentation, filtration, and then the clean water is sent from the tank to the household levels. Several technologies are introduced to reduce the fluoride content. As I just told you, the Nalgonda technology developed by the National Environmental Engineering Research Institute at Nagpur. Lime and alum is added. The advantage is it is suitable for both domestic and at the community level. Models to suit different localities are available and it is cost effective. The problem is the quantity of lime and alum are crucial and vary with the alkalinity of water and seasons. It needs a trained operator, and there is a possibility of aluminum contamination which can be toxic. There is another technique given by the Inter-Country Center Oral Health Bangkok in collaboration with WHO, what is known as the ICOH technique. It makes use of charred bone meal and charcoal columns for passing the water. The advantage is it is simple, inexpensive, and the unit remains active for 1 to 3 months. The problem is it gives a foul odor in the initial 12 to 20 liters of water. It can be unacceptable on aesthetic and religious grounds, especially by vegetarians. It is not suitable when water is scarce. So, in conclusion, we can say that though fluorine may not have any physiological functions, it is an important element for teeth and bone formation. Deficiency can cause dental caries, while excess causes dental and skeletal fluorosis. Excess fluorine from water can be removed by very simple techniques which are developed by the National Environmental Engineering Research Institute NEERI at Nagpur and the Inter-Country Central Oral Health ICOH Bangkok in collaboration with WHO. Thank you.